Look, we're extremely excited to be the first practice in Brisbane and to be the first dermatologist in Queensland to be able to offer Aviclear. And really, we've been waiting 30 years in dermatology, over 30 years, to be able to provide our patients with a non-pharmacological solution for acne, moderate to severe acne. Now, traditionally, we had a couple of different options. We could go down the drug route, which worked very well, but it didn't suit a lot of patients, right? They could either have side effects or they had other medical contraindications to medications or didn't like taking medications. Then we had lasers that weren't specifically able to treat the root cause of acne. Okay, so we had lasers which would reduce inflammation, we could reduce the bacteria causing acne, but the sebaceous glands and the acne still continued. Now, what we have with Aviclear is now an avenue whereby we can provide long-term solutions for patients with acne in a non-pharmacological way. So we can actually reduce sebaceous gland activity, reduce acne, and do this in a way without the medication-related side effects, and patients love this. This is going to be groundbreaking, really, in terms of the patient experience, because acne treatments have always been pharmacological and over many, many months. Okay, so what you end up having is side effects that affect you hormonally, that affect you in the surface of the skin with dryness and headaches and sun sensitivity and some mood changes for people, but this can then happen for months. What we're offering with Aviclear is 3 treatments spaced over a 3-month period, about a month apart, after which we then have ongoing improvements over 6 months and 12 months after that. So this really changes how that treatment experience for acne actually evolves. So instead of having a long, slow, painful burn before you get a result, you're giving a more short, sharp treatment courses, which then have a much more pleasant long-term solution. To be honest, doctors historically haven't always been the greatest communicators with patients. And sometimes even dermatologists have had a reputation where we have said to patients, look, you have acne. Unfortunately, the only things that's going to work for you is this group of medications. And if you want treatment, that's what you're going to have. Now, that often sort of slams a door. There's going to be patients where this doesn't work well for, or it's not in keeping with their holistic, healthy lifestyle. This new avenue gives us an opportunity to communicate and actually go by the desires of patients who are looking for a more holistic, non-pharmacological or drug-free approach to treating their acne and treating their skin. So, it's a delight to be able to sit down with patients and give them an opportunity to voice their concerns about some of the traditional acne treatment options, and then to be able to give them a good, consistent, scientifically proven long-term acne solution. The nice thing about being dermatologists is we are very used to being able to both combine medical and procedural techniques to provide our patients with good long-term outcomes. So I'm a laser specialist. I use energy-based devices, but we can also use medications in combination with peels and lasers to then guide patients to the best outcomes. Aviclear gives us a massive energy-based device boost in terms of giving a result to patients. But the great thing about being a dermatologist is we have the experience to be able to deal with any of the side effects that you can get during a normal course of your acne. So we can reduce flares, we can treat patients by putting things on their skin topically, by giving them short courses of oral treatments, just to be able to make their experience as pleasant as possible. So the good thing in our hands is that we can use combination treatments, not just the laser, but the right combination of treatments to give the patients a really, as pleasant an outcome or pleasant a treatment course as possible. It's not just the acne improving, with energy-based devices such as the Aviclear, and the fact that we then combine it with other laser techniques like Genesis with the XLV, we can actually reduce inflammation, improve the tone and texture of the skin, reduce post-inflammatory erythema, which is the redness that exists even as the acne is settling down. And most importantly, we can reduce the risk of the main long-term problem with acne, scarring. Okay, so what we can do is give an immediate result with the acne and the tone and texture of the skin and the inflammation, but we can also mitigate the risk of acne scarring long term by putting this combination of treatments together.